Hello everyone, I'm Dr. Kristine Van Winkle. I'm an internal medicine and pediatrics physician and I've been with Community Health Network for the last 5 years. I love working in primary care, seeing patients of all ages, from newborns to nearly 100-year-olds. August is Vaccine Awareness Month and we are going to talk today about the important health benefits of vaccines for you and your family. Vaccines work with your body's own immune system to help protect against various diseases. The recommended vaccine schedule for kids helps protect them from 16 serious diseases by the time they turn 2 years old. But remember, adults need vaccines too. Vaccines protect us from all the diseases on screen. That's a lot. We are very fortunate to have protection against these diseases that used to cause severe illness, long-term disability, or death for so many millions of people worldwide. You can find the vaccine schedules online or at your doctor's office. We'll include a link to them in the information below this video. And while that seems like a lot of pokes, there are many vaccines that are offered in combination now, providing the same amount of protection with less pain. The good news is, side effects from these combination vaccines are usually mild and similar to those from individual vaccines given separately. There are so many important vaccines available, and we don't have time to talk about them all today. But I'd like to highlight the new protections that became available last year against RSV, or respiratory syncytial virus. Many parents have heard of this virus, which causes congestion, wheezing, and difficulty breathing in infants and young children. But did you know that some adults are at high risk of getting seriously sick from RSV too? Each year in the US, there are about 70,000 hospitalizations among children younger than 5 years old and around 200 deaths. About 100,000 hospitalizations among adults 65 years and older and around 8,000 deaths. Doctors are excited to have several new ways to reduce suffering from RSV. You can protect your baby in one of two ways this coming season. First, if you are between 32 and 36 weeks pregnant during the RSV season, usually between September and January, ask your OB about the Abrysvo vaccine. This vaccine helps you produce antibodies against RSV to pass to your baby before they are born. Second, babies younger than 8 months who are born shortly before or during their first RSV season can get an antibody shot called nirsevimab or Beyfortus. This directly gives them the antibodies to fight off RSV infection. Adults 75 and older and those 60 to 74 who are at higher risk of severe RSV, such as those with chronic heart or lung disease, diabetes, or immune suppression, should receive a single dose of an RSV vaccine. Be sure to ask your doctor this year if the new RSV protections are right for you or your baby. Vaccination is a topic that your doctors are passionate about. Before we wrap up today, I'd like to acknowledge that unfortunately, there is a lot of misinformation online and in the news about vaccines. This has led to vaccine hesitancy, decline in vaccination rates, and an increase in cases of preventable diseases like chickenpox, mumps, and measles. While it may seem overwhelming to navigate all the things you are seeing and reading about vaccines, please know that your primary care doctor is an excellent source of information and will be able to discuss any specific questions or concerns you may have. Your doctor can review what vaccines you or your child are due for, the protections they provide, and any common or unusual side effects to watch for. In addition to your primary care office, you can get many of the available vaccines through your pharmacy or your local health department. Thank you so much for taking some time to learn about vaccines with me today.